Hey guys, so today I'm going to do a presentation on tic douloureux, and I'm not sure if I'm saying that correctly, so from here on out I'm just going to refer to it as TD to make it easier. So what is it? Tic douloureux is also known as trigeminal neuralgia, and it's a chronic pain syndrome that affects the trigeminal or fifth cranial nerve. TD is a form of neuropathic pain that is associated with nerve injury or nerve lesion. There are two forms of TD, classic and atypical. Classic is accompanied by extreme, sporadic, sudden burning or shock-like facial pain, and it can last anywhere from a few seconds to as long as 2 minutes per episode. These attacks occur quickly and can last as long as 2 hours. Atypical type is characterized by constant aching, burning, stabbing pain of somewhat lower intensity than type 1. And both types of pain can occur in the same person at the same time. So to talk a little bit about the trigeminal nerve, it's the fifth of the 12 cranial nerves, and it originates in the pons region of the brain, which is the area in the front of the brainstem, and it's attached to the brainstem by two roots, the sensory root that controls sensation and the motor root that controls movement. And it can also control ipsilateral facial the trigeminal nerve together controls ipsilateral facial sensation and masticatory movements. The trigeminal nerve has 3 branches that stems from the sensory root. One is the ophthalmic or upper branch, and it supplies sensation to most of the scalp, the forehead, and the front of the head. The maxillary or middle branch stimulates the cheek, upper jaw, top lip, teeth and gums, and to the side of one side of the nose. And then the mandibular or lower branch supplies nerves to the lower jaw, teeth and gums, and the bottom lip. And these 3 nerves converge on the trigeminal ganglion, and the trigeminal ganglion is analogous to the dorsal root ganglia of the spinal cord, which contains the cell bodies of incoming sensory fibers from the rest of the body. So here's a good picture of the pons right here, and then you can see the 2 roots, the sensory root of the trigeminal nerve, the motor root of the trigeminal nerve, and then here is the actual trigeminal nerve that splits into the 3 divisions here. And this is just another one with the face. You can see here the trigeminal nerve and then the 3 branches, and you can see with the branches what areas they supply. So the effects of normal neurophysiology and neuroanatomy. Abnormal blood vessels compressing the nerve as it exits the brain can cause the pain that's associated with TD. And the blood vessels can also damage the nerve as it passes through the openings in the skull to the muscles and tissues of the face, causing the nerve to shed the protective conductive coating. So the nerve's protective and conductive coating is the myelin sheath. So this process that happens is called demyelination. And I know we are familiar with MS, and TD is associated in common with patients who have MS because MS is a disease that causes demyelination to the nerves, so it can target the trigeminal nerve, which results in TD. You can also see biomechanic change in the nerve tissue, and this can be caused, the nerve can lengthen or stretch, and this can be caused from tensile strength or stress that's placed on the nerve. And in all cases, an excessive burst of nervous activity from a damaged nerve can cause painful attacks. So I'm going to go to this next photo, and you can see here, this is a normal trigeminal nerve that has no vascular compression. But if you go over here to this one, you can see the irritation of the trigeminal nerve root and this is a neurovascular compression. So you can see that it's compressing on the trigeminal nerve, and what happens is this compression sends hyperactivity into the nucleus of the trigeminal nerve, and all that hyperactivity is what shoots out all the different pains depending on what nerve is or which branch is associated. So symptoms of TD. The main symptoms is sudden, severe electric shock-like pain on one side of the face. Because the second and third divisions of the trigeminal nerve is affected, the pain is usually felt in the half of the face, cheek, jaw, and or upper lip, The pain comes in intermittent episodes that can last from seconds to minutes, and there is no pain between episodes. Pain episodes can last from weeks to months and can have pain-free periods of months and even years. The attacks of pain are typically initiated by physical stimulation of a trigger point on the same side of the face as the pain occurs. Trigger points can occur in the face or in the mouth or nose and are typically not in the same place as the pain. Stimuli that can initiate the pain include talking, eating, brushing the teeth, or even cool air to the face. And there is no loss of taste, hearing, or sensation in this disease. The affected population, females are affected more than males. The exact incidence is unknown, but it's estimated that there are 10,000 to 15,000 new cases that occur each year in the U.S. And the disorder affects individuals more than 50 years of age, but cases can occur in younger adults. And in younger individuals, the cause is typically idiopathic, but when compared to older adults, cases are likely to be caused by damage to the central nervous system, as in individuals with MS. The prognosis. TD is an unpredictable disease. People may experience episodes where symptoms exacerbate over a period of days, weeks, or even months. This period may be followed by pain-free intervals that can last from months to even years, and the type of treatment may affect the symptoms. So we have treatment. Ooh, so sorry. Okay, medical treatment. So medication included anticonvulsant and muscle relaxants will be provided in hopes to help relieve the pain. Surgery for patients surgery will be provided for patients that are experiencing debilitating pain that can't be controlled by medicine. So a couple types of surgery include microvascular decompression, and this is an open surgical approach where a small incision is made behind the back of the ear, and a hole is drilled in the skull to expose the trigeminal nerve. And after the exposure, the compression to the nerve, which is typically a blood vessel, is removed, and it's supposed to result in pain relief. There's also radiosurgery, which is a gamma knife that's inserted into the skull where it enters the brainstem to deliver beams of radiation to the trigeminal nerve, causing damage to the nerve to stop and the transmission of pain signals to stop as well. Radiofrequency lesioning is an electrode that's inserted through the cheek to heat the nerve and to stop the pain signals from traveling to the brain. OT treatment for TD will be focused on pain management to improve participation during occupational performance. Treatments can include electrical stimulation, also identification of tasks that exacerbate pain, and provide modifications or adaptations to enhance the occupational performance. And with TD, social isolation is also really common because of the pain. So OTs can help in preventing that social isolation that's caused by the pain through encouraging participation in group activities that are of interest to the patient. Okay, so here are the questions and the true-false essay questions and my references. I wanted to get to this video. It's a really cool video about a girl named April who has TD. This is a really horrific disease. It's so horrific that it's been named the suicide disease. So I'm going to start this video. It's about 6 minutes, and I'm honestly not sure how much time I have left. So I'm hoping that it gets through the part of the video that I really want you guys to see. I hope you've enjoyed this presentation. and I look forward to answering your questions.
Trigeminal neuralgia is a rare neuropathic disease that affects the trigeminal nerve, which carries sensation from your face to your brain. Trigeminal neuralgia is caused by a blood vessel or artery growing and pressing on the nerve. It is the worst pain known to mankind and causes attacks of pain in the face, which can be compared to having a hot poker in your eye, taking a chainsaw to your head, lighting your face on fire, and chewing on a handful of nails all at the same time. It is nicknamed the suicide disease because majority of patients take their own lives because the pain is so bad. There are surgeries, injections, and medications that have helped many patients. However, my mother's tried everything and unfortunately had no luck. She has trigeminal neuralgia in all 3 divisions in her face and nothing helps to ease the pain. Something as simple as brushing your teeth, sunlight, walking, or talking can set off a series of violent attacks of pain. This isn't something anyone should have to go through or even watch happen to a loved one. Trigeminal neuralgia has stolen my mother's life for the past 3 years. She has been bedridden for all of these years, suffering and most of the time unable to walk, speak, or eat. No one should have to live like this. However, she sure is a fighter, and we're praying for a miracle for her to have her life back.
Today is August 17th, 2015. I have been fighting to survive with trigeminal neuralgia for almost 3 years now. Right now, I'm currently having ice pick pain on the side of my head, trigeminal nervous. I ride in a vehicle, feels like that ice pick is bouncing up and down in my head, jabbing and then bouncing like this. My face right now feels like it's out to here, and there's a hot blowtorch literally burning and sizzling my skin and all my nerves. And it also feels like it's smashing, crushing in a pain. I'm getting electrical shocks. All of my teeth inside my molars feels like you're them out with pliers. You can see the droop. My voice right here swells out, becomes very, very red. You can't see. My eyebrow usually goes up. This eye swells. Oh, my eye. Feels like there's a axe stuck in the back of my head on the greater occipital nerve, which I had a sphenopalatine ganglion injection about a month and a half ago back there. It didn't work. Anyways, back there, feels like an axe is stuck there. In my eye, a hot poker, sizzling and burning, jabbing as it enters my eyeball inside. The whole entire right side of my face has a tiny bit of numbness usually. It's been very difficult the past 2 weeks. I've been 5 days having crazy attacks on the floor if I'm standing or in bed for hours at a time. They only last seconds. I get a break to breathe, catch my breath, and then another one comes on.
Like a small boat on the ocean.
Alright guys, so that is the video. I hope you enjoyed. At the end of it just shows pictures, but I just thought it gave a better depiction of how serious this disease is because I didn't really